Okay, thank you so much. First of all, I'd like to thank every one of you for giving me this opportunity to present to you a game changer, which is Cabotegravir, which was done among a special population, female sex workers, and MSM in Nakonde district. My name is Lubinda Chingumbe. I'm an independent consultant from the Center for Public Health Promotion in Zambia. Straight away, all of us have heard that Zambia was the first country to implement Cabotegravir outside the study setting. And so during our study here, the rollout was done to target female sex workers and men who have sex with men. This is a population that is at substantial risk of getting HIV infection. As you are aware, Cabotegravir offered a convenient alternative source of HIV prevention for the female sex workers and also men who have sex with men. It also offered addressed adherence challenges if you look at taking oral PrEP, and also reduced stigma and also enhanced the prevention outcomes. Those of you who do not know where Nakonde is in the far north of Zambia, neighboring with Malawi and Tanzania. And it is a gateway of activities in East Africa. And if you want to come to Namibia from East Africa, you have to pass through Nakonde, and a lot of activities among female sex workers and MSM happen there. Cabotegravir became a game changer in that particular district, and I would want to call upon all of you to see this as a game changer in the HIV prevention platform. The study also evaluated the outcomes of Kabele among these female sex workers and also the district there. The methods that we used was a mixed method. We did qualitative data uptake on retention and certification of our clients using program records, and also we did focus group discussions. We also explored factors to do with willingness and also to initiate Kabele and barriers, looking at retention over the first 6 months. Let's go to the results quickly. So for the results here, as you can see, we did in note 250. Among them, we approached 85% were female sex workers and 78% MSM. Some did not initiate, and this particular rollout worked out so well for our country, Zambia, because we worked out with the civil society organizations and used KP micro-planning initiatives to enhance education and reduce misconceptions. Here are the results that clearly demonstrate that Kabele is a game changer in the HIV prevention cascade, and I will not go through this because of time, but you can see how the results came out. And as you can see, I just want to talk about retention and maybe also acknowledge yesterday's discussion we had. I think you heard from Zimbabwe in the study platform where these side effects around here were noticed around the clients. The strategies we used to successfully do this, we ensured that we did peer education and also involved the KP community itself and community engagement, including KP micro-planning. In conclusion, Kabele is a game changer. It is the way we need to go, all of us in Africa, to prevent HIV. And also, allow me just to acknowledge my colleagues who helped me in this study. Thank you.